Striking work.
We actually managed to get inside before we were kicked outside the hospital, but what we saw inside is that nurses, some doctors and also the support medical staff are actually holding a mass meeting. We weren't able to get information as to who are they referring their problems to. But Arabile, if you remember yesterday, I did a story with one of the doctors, two of the doctors here from this hospital, and I was so alarmed when he told me that a simple thing such as a mask, he has to ask the nurses for a mask, then the nurses go on to say there is no mask. He then has to steal the key that has the mask in the storeroom and takes those and gets the mask for himself. He says they don't have gloves, they don't have the mask, and also the sanitizers. There is such a shortage of sanitizers that actually keep them with them, because if they leave them on the desk, they could go missing. So the staff in this area are saying that they're going to down tools up until the Department of Health steps up and gives them the right gear to deal with this virus.
Yeah, it's a plea that must be heard, that certainly must be adhered to. Any word then from health authorities, not just in the area, but perhaps even nationally?
We actually spoke to the superintendent, Dr. Mpengashe, on Friday, and he said that by Monday, all the hospitals in the Eastern Cape, all the staff, he will make sure that all the staff working in hospitals have the right gear, especially the mask and the gloves. But to date, there's nothing as yet. We also tried to get a comment from the Department of Health to see, are they aware of the strike? They're currently investigating and said they'll revert back to us as to what the strike is about and exactly how they're going to intervene to try and obviously help the people of this area. Because Arabile, this specific hospital is actually in a township area. The majority of these people here are unemployed, either not working, come from poor homes, and this hospital then becomes a lifeline for them, especially during the outbreak of this virus. So should workers down tools, so many people's lives are going to be put at risk because there's no medical fraternity close to them.
Yeah. Have you gotten a sense as well of what the facilities are like in terms of the capabilities of the hospital, whether the ability to test for COVID-19 still is maintained within the area, and whether they're trying to get an increase in that, of course, dependent fully on whether the health department plays its role?
Sorry, Arabile, can you just repeat that question? I didn't hear it.
So really just talking about whether we've gotten a sense of whether they are looking to increase or keep the same in terms of their testing capabilities and what their facilities look like in that sense. Do they have the capability to continue testing people for COVID-19?
When we spoke to the doctors yesterday, they said that before the outbreak of the COVID-19 virus and now, this specific hospital is not ready to deal with this virus. And that was actually scary coming from someone who's on the ground who said that before the COVID-19 virus and now, he as a doctor doesn't feel that they have the capability to deal with the outbreak of this virus because the medical staff themselves don't have the right equipment.
Yeah. Do you know how many beds are in the hospital? And really, I just asked this really, if there's anything that should happen in that area where you aren't, the sense is that there aren't enough protective gears, as you've just made note of. There isn't enough in terms of screening and testing going around in the area. Perhaps awareness is also lacking as well. Are there enough beds in the area to keep people perhaps, healthy in some way or other?
In Port Elizabeth, there is one specific hospital, Livingston Hospital, which has been identified as a quarantine hospital. I know that currently there are plans to try and make this hospital also a quarantine area, but I agree there's so much work to be done here before that it can even start. Because if you think about it, if the medical staff are currently struggling with the basics such as masks, the basics such as gloves, how do they then take people that are positive and put them in such facilities?
Yeah. Have you gotten a sense of awareness as well around the area? Are people being made more aware of the virus as well?
I think with the increasing rate of numbers in PE currently sitting at 25, I think people are becoming anxious, are becoming scared. But when you drive around the township in certain areas, it seems like it's business as usual. People are anxious, people are scared, but at the same time, people are also blasé about this disease. People are still referring it to the disease that's still far away in other countries and perhaps other races as well. And I spoke to the Minister Oscar Mabuyane last week, and I asked him, in their drive to push mobile units to prove testing, are they also going to embark on educational aspect as well?
Yeah.
Because I feel that's a bit lacking, especially in the rural and township areas.
Yeah, certainly very, very important. Lerato, thank you so much for that comprehensive report there coming through from Lerato Fekisi out in the Eastern Cape. Then as we get a sense, look, in the more urban areas, it perhaps is a little bit easier. Once you get to rural South Africa, it becomes a whole lot more difficult. The word to government right now is certainly look after it. Take care and certainly make a more concerted effort to try and get involved in those areas to make people